So dear students, I will show you the image, find out what exactly it is and what are the implications. So what is this X-ray? Look at that chest X-ray, it is there, lung shadow is there. Look at the trachea, which is not straight like this. It is deviated towards the left. See that? Deviated like this. See that shadow, tracheal air shadow is there, deviated towards the left. This is the right side, this is the left side. So deviated towards the left side. This is a very typical tracheal deviation towards the gross tracheal deviation towards the left side. Maybe right-sided large thyroid. Maybe there is retrosternal extension also. So patient may be present with the stridor. So by three-finger test like this, you will be able to find out where exactly it deviated. Trail sign is opposite side sternum will be more prominent because of the push of the trachea towards the opposite side. So that is the trail sign. That's also you have to remember. You have to do a CECT chest and abdomen to see the retrosternal extension. Doing study also. And also you may have to do an angiogram to find out the blood supply. It's not necessary in every patient. T3, T4, TSH, FNH should be done. And then you have to treat surgically, total thyroidectomy. Most of the time with the neck, because blood supply is from the neck, even though there is retrosternal extension, through the neck incision only, we'll be able to retrieve the retrosternal extended goiter. Often, if it's not possible, then only you have to do a sternotomy and remove the thyroid entirely. So, most important thing is intubation may be difficult. They need a visual bronchoscopy. Through bronchoscopy, fibrobronchoscopy, we may have to use to pass the endotracheal tube. And post-operatively, this patient may go for a tracheomalacia with a weakened cartilage, may land with the tracheostomy, which is usually temporary for few weeks. So you have to take the consent for tracheostomy. You have to inform the patient beforehand because it might require. So all these things you have to think and plan while doing surgery in such a patient. So FNAC, total thyroidectomy, neck incision, sternotomy, tracheostomy may be required. So all these things, whatever I have told, is mentioned here. And absence of hollowness on the side of the deviation, prominent terminostide on the side of the deviation of trachea, opposite side of the enlarged gland, trail sign is often asked as an MCQ. Viva they will ask. When you present a long case in the thyroid also, they will ask what is trail sign, how to examine tracheal deviation, clinical also important. So many examinations of thyroid, I already had a small brief video lectures like trail sign, Stelvag sign, and one Griff sign, then Mobius sign, and we had a live thyroid examination session of 1.5 hours earlier. Please go through that session. In detail, thyroid examination was discussed with interaction with the students present in the case, with the senior faculties were on the live platform. So please go through that earlier live session of examination of thyroid. It's very, very useful for you. And many thyroid topics I have already discussed in my brief lectures. So scroll back for those lectures also as a supportive lecture for this. So that will be very, very useful for you. Always, again, also go through my clinical methods in surgery for better understanding of this trail sign, and also manual of surgery to understand about the retrosternal goiter. So 3-finger test. This is exactly you will do see the photo of exactly you will do the 3-finger test clinical method. So students who go through my manual of surgery have it, my clinical method surgery. Also again requesting subscribe my YouTube channel for better understanding of the day-to-day knowledge about the surgery by brief lectures for 5 to 8 minutes. So case report, images, instruments, operative procedures briefly, and live sessions in regular intervals it will be there. So whenever they are join live session. Have interact with in the live session through chat box, and if you join live session get a certificate for that. It will be very, very useful for you. Answer them, I will get back to you and acknowledge your answer. Berry sign is seen in toxic thyroid, advanced carcinoma thyroid, Hashimoto thyroid, dysharmonogenesis. Second MCQ is half-life of radioactive iodine 131 is A, B, C, D, 13 hours, 4 days, 8 days, right? Put the right answer, I will get back to you. So quotation of the day is, problems are not stop signs, but they are guidelines. So problems, you should learn to rectify it. So how to rectify it? It's a planning. Same thing what is surgery is a planning. Managing a physical patient is a planning. That's what exactly it means. Very, very useful for surgeons. So students, please go through my SRB's manual of surgery. It gives a detail about all CBME syllabus and covers both for MBBS and postgraduate also. We've got MCQ for each topic wise. General surgery, gastrointestinal surgery, urology, specialty basics, urology, neurosurgery, cardiothoracic. All those basics are covered. Instruments, adjuvant therapy, chemotherapy, briefly about anesthesia, specimens, briefly about anesthesia, briefly operative surgery, and current recent advances also. Everything covered with the quotations, with the illustrations, with the photos. Everything is covered, more than sufficient for undergraduate to go through this book, learn surgery, and face exam, face MCQs, everything for both UGs and postgraduate. Also go through my clinical methods in surgery with the video of how to examine each topic. It is a detailed examination method, but of course there is no management in this. It is a clinical book, and briefly in a tabular form, differential diagnosis and good photos, and exactly how to examine and how to write patient of each different topic, ulcer, swelling, breast lump, and everything covered. Briefly orthopedic also. It also has got specimens, images, instruments, which can always be useful when you take Viva and OPSI and practical exam. So very, very useful. That would have all videos of how to examine patients. Very, very important in your practical exam of any medical graduate of any type. It will be very, very useful. So please go through it and have it. And my operative surgery, the 2-volume book, new edition has come, and it was extensive discussion about the methodology, technical principles, and steps of the different doctors, major to minor. Everything is covered with around 10,000 illustrations and photos. And my tissue atlas of tissue approximation, small 100 pages book with the video, how to do suturing in different situations properly with the video has shown very well, and can always go through that. And my begin our lectures through JP Publishers around 220 hours. So everything A to Z topic, urology, specimens, instruments, clinical examination, videos, everything it is covered. Please you can purchase for a year so that you will have the clear idea. You can face the exam, have the clear idea, academic part, everything. You will have entire subject is covered, including clinical part. So please purchase and have a clear idea about subject and face the exam. So students, I hope you have understood this lecture very well. Thank you so much.